You're tuned into Visions, a business and community affairs program designed to encourage and promote entrepreneurship in Central Alabama.
Thanks for tuning in to another edition of Vision. Cedric Vaughn are excited about our guest and our subject today. We're talking with Mr. Gilbert Darrrington, who is the CEO of Health Services Incorporated. Mr. Darrrington, thanks for being with us again.
Thank you
on
so
the program.
much. Thank you so much for having me.
It's been a little while since we had a chance to talk, and so a lot has happened since we've been together.
Yes.
So you've got a new office a new location that you're opening. You're going to talk about that, but we want to just start out by asking you the question for people who are not familiar with you and the organization.
Okay.
What is Health Service?
Well, we are a federally qualified health center, which means that we receive a small grant from the federal government to offset the cost of care that we provide for uninsured patients. But we are a primary care medical home, so we provide primary care. So you would have a person who becomes a patient of ours has a primary care physician or a primary care provider who takes care of all of their healthcare needs. And we provide a wide variety of services, primary care, so your regular annual visits, annual physicals, pharmacy service, lab services, optometry services, behavioral health. So a person becomes a patient of ours. We are a patient-centered medical home, meaning that the patient is the reason for us being there. And then we provide that care to everyone regardless of their ability to pay. So we have patients who are fully insured to patients who are uninsured, and we provide the same quality of care for all patients regardless of their income. Wow. So, and we're in 5 different counties. We have 10 different locations that we provide care. We have a mobile unit here in Montgomery that goes around to several different communities to provide care. And then we have 2 wellness centers. So our providers can actually prescribe a workout regime for patients maybe who need to exercise a little bit, to add that into their daily plans. So we have 2 wellness centers, one here in Montgomery and one in Hayville. So we just provide a wide variety of services to as many people as we can. And we're looking for all different types of patients to come, and we provide care for newborns all the way up to geriatrics. So a lot of services. You
really do provide a lot of services. You mentioned the mobile units. I think many times I see those out at the library.
Yes.
Various areas in the community.
Right. Yeah. And so we do. We go around 2 days a week to different either shelters or just some convenient locations where individuals who don't have transportation to come to one of our fixed facilities, we offer the mobile unit for them to place close to where they live. And we have a nurse practitioner on the mobile unit and a complete staff. And they can come in and get annual screenings, they can get eye exams, a lot of different things that we provide on the mobile unit. Some things we have to refer back to one of the centers, but in general, annual physicals, or if you're not feeling well, need to be seen, we provide those services on the mobile unit. So,
well, we got a lot going on as it relates to healthcare in the nation, and of course we got veterans. You've got a special program that you do for them.
That's right.
How does it work for people who may be on fixed income, lower income, whatever the scale? How does it work when they come to see you all who are in need of a primary care physician?
Sure. So we verify the income. So our system is set up as we take care of individuals in a particular county. Okay. So we have 5 counties that we serve. So there's a clinic in each one of those counties. So a person has to show proof of their residence in that county, and then provide proof of income. And then based on, we operate off a sliding fee scale. Okay. So based on the income level of the individual, they may have a copay of $30, or they may be a full slide. And with that slide, they receive all of the services for that visit. So if they need lab, they need x-rays, and all of those comes with that one payment. So that makes it that makes it attractive for the individual who can't seek health care other places. But again, even with a person who has a limited income, they're still going to receive quality care, just like the person who comes in with full coverage.
That's good.
And there's no difference. Once they get past that part of verifying income, they receive the same benefit once they get back to the clinic side of it.
Okay. Now, Health Services. Now, you're not new to the community.
No, we're not new. We're not new.
How long have you been around?
So next year, in June, we're going to celebrate 50 years being in the community. So a lot of people think of health services as Lister Hill. So we had one facility called Lister Hill that many people know about, and we tore that facility down and moved into our new River Region Center, but that's just one location of the 10 that we have. So we've been around providing care for 50 years in the community and looking for another great 50 years of providing quality care. Yeah.
Okay, so in other words, what you're saying is that, you know, you're not new to this.
No, we're not new. We're not new. We're not new. Now, I've been there 2 years, but yeah, the organization has been around for 50 years.
Okay,
so,
great.
Yeah.
Well, you know, you just recently opened a new location.
Yes.
And
yes.
I want to go to the slide that we have of the ribbon cutting of your new location. That is on the East South Boulevard?
Yes, it's in the old Montgomery Mall, the One Center, and we're very excited about that location. We moved a pediatric.
Got that on screen now?
Yes, there we go. We moved a pediatric location. We had one on Whitley Road, we call South Side. So we closed that location down and moved into the One Center to have a better access for more of the residents right around that area. So we're in the One Center. We provide adult services and pediatric services in Gateway. It's called our Gateway Family Health Center.
So that's 2905 East South Boulevard.
2905 East South Boulevard, yes.
All right.
And the good thing about that location is that we're open 6 days a week from 8 in the morning to 8 at night. And one thing that I've heard, some feedback that I've received about that is that children don't have to be taken out of school. We can actually schedule appointments after hours or on Saturdays. And so, you know, the parents don't have to worry about taking the kids out of school, or the parents don't have to take off work to come and be seen. If it's more convenient to have an after hours or a Saturday appointment, we can make those appointments. So we are fully functional now with adults and peds at Gateway, and we're really excited about that location.
All right, so what about Ms. Darren? What about people like me that wear glasses? What do we do?
We have services for you too.
You got
Exactly.
You got some for
Exactly. So we have an optometry department.
Okay.
And the exciting news about our optometry department is that we're opening up full time starting on November 27th.
Okay.
And what we're going to do, we're going to stagger the times with the optometry department, and it's a full service optometry department. Okay. So regular eye exams all the way up to prescribing glasses and those things. We're able to do. We have the capability of doing, and we're open from 12 until 9 at night. And the optometry department is in the River Region Health Center, which is located close to the Jackson Hospital campus. But we have Dr. Ford as our provider there, and he's well known in the community and a very good optometrist. So we're very, very excited to have him coming full time with us.
Now let me ask you, you are on the slide we just saw, it said OBGYN and family medicine.
Yes, so again, all the services that you could think of, we provide at Health Services. So we do have OB services, and we have a lady goes, if one of our patients, we have partnerships with the local hospitals, so our patients are seen in the clinic, OBGYN clinic in River Region. But then when it's a delivery, when the baby's time for the baby to come, they go to one of the hospitals, and we have providers who actually deliver our babies in the hospital and then follow back up with us at the River Region or one of the other locations. So yes, a wide variety of services.
Not only a wide variety of services, but you have a lot of locations. You know, slide we just had, and we're going to put that back up. I mean, I was just, you know, really surprised at how many locations you have. So,
that's right.
So you're serious about this?
We're very serious, very serious. You know, and a lot of we have 5 rural sites. We have Clanton, Neglected, Toggable, Raymer, and Hayneville, all centers in those different areas. And so the residents of those areas don't have to try to come to Montgomery to receive that quality care. There may be some things that have to be referred to, such as x-ray. We only offer x-ray services in Montgomery at the River Region Center, but the visits, the normal visits they can have in their local communities with one of our qualified, very qualified providers and the medical staff who's there, and they don't have to travel that far. We're right there in those communities.
That's good.
So it's very good for the community.
Well, so how does a person become a patient of health service?
Yeah, again, a couple different things is just come into one of the centers, and with a proof of income and proof of residency, and then we sit down, of course, and determine the needs and give them assigned to a provider, and they receive care.
Okay.
Yeah.
Well, now, and as relates to care, you got some legendary health practitioners.
We do.
I mean, you know, we're just going down some of the names. These are people who are established, who are well-known.
That's right.
Experts.
That's
taking
right.
care of
That's
our
right.
community.
Been doing it a long time.
Yes.
We have several providers who've been with HSI for over 20, 25 years. So and just love what they do. Love the patients love them, and it's just exciting too. Our mission is to take care of everyone, regardless of the ability to pay. And just when you see some people that you heal and help to live healthier, it just makes you feel good. And a lot of our providers really believe in that. Okay. So it's really a good thing that we provide.
Excellent. Well, we're very inspired and impressed by the way that you're taking care of our community. Your marketing director, new marketing director, Ebony Evans. She's put us
fire,
together. She's taking care of business, and she also gave us a slide. You're going to be doing a promotion relative to the Iron Bowl.
That's right.
And
that's right.
so just kind of give us an overview of what you're going to be doing on that. I think November 1st through the November 30th.
That's right. So we're doing a book drive. So not only do we cater to the needs for the health needs of our patients, we're also thinking about the community and helping our children grow to become productive members of the society. So and that all starts with education and starting with reading. So we have a reading program that we've started, and what we're doing is we're having a promotion. We want some gently used books to be donated to us, and so we're going to have an Auburn, Alabama contest.
I understand.
So if you like Alabama, you bring some gently used books and stuff it in the Alabama box, or if you like Auburn, you stuff them in the Auburn box. But these books will go to the children. So when the children come in for their visits, whether it's an annual visit or just a routine checkup, they're going to leave with a book. So we want every child who comes to one of our facilities to leave with a book. Okay. And they can return the book and get another book. We want them to get into the practice of reading. We want the parents to get involved to read stories to the children, so the parents can come in and get books as well. So we just started this program about a month or so ago, and it's going well. We've had some people come in, some from the community, to do readings at the center. So we just want to give back in any way we can to help our community and help our patients.
Excellent. Yeah. Well, Mr. Darrington, we've got to go, but we want to say thanks for coming to be with us again on the program.
Thank you so much.
We're going to invite you back because you're doing so much that we need to make sure that our community knows everything that you have to offer. And that's going to do it for us on this segment of Visions with Mr. Gilbert Darrington, CEO, Health Services Incorporated. Please stay tuned. We'll be right back.